Good morning everyone. I am Samantha Abujin from BS Nursing 2. Today I am going to perform Leopold's maneuver. For the assessment, first complete the following. First the OB score, then second the EDC, and then for the third is the AOG, and then for the nursing diagnosis, risk for injury-related mechanical obstruction of fetal descent. Then for the outcomes, the patient will remain free of infection after the delivery. And let us proceed now in intervention. For the first maneuver, determining whether it's head or buttocks, heads are firm and move independently. Buttocks are soft and move with the body. First, we need to position the patient. Make sure that the patient is in the supine position. Next is to stand at the side of the bed facing the mother and then palpate the uterine fundus with warm hands. Create a triangular shape of your hands and then determine which side of the uterus is long axis of the fetus. And then for the second maneuver, determining the location of the back feels firm and smooth, extremities are small and bent. First, we need to place the palmar surface of both hands on either side of the abdomen and then apply gently but deep pressure in one side of the abdomen. And then palpate the opposite side from the top of the lower segment of the uterus in slightly circular motion. Determine which side of the uterus is long axis of the fetus located. For the third maneuver, determining the part in the pelvic outlet. Grasp the lower uterine segment with thumb and fingers. Identify the presenting part and then determine the mobility of the presenting part. Lastly, for the fourth maneuver, determining cephalic prominence. Stand to the side facing the patient's feet. Place the tips of the first 3 fingers on both sides of the middle about 2 inches from the inguinal ligament and then apply pressure downward and in the direction of the birth canal and then confirm the presenting part. And now we can cover the mother and provide her privacy.
Good morning everyone, I'm Shanley Sicat, and for today's video, I'm going to demonstrate the proper procedure in assisting and handling delivery. So first, you have to prepare the OB pack. So in preparing the OB pack, check the OB pack and check if it has a complete instrument. Then second, we have to open the outer lining of the OB pack, and using the bare hands, I'm going to open the outer lining of OB pack. Then after that is using a sterile forceps to open the inner lining. Okay. Then now we can proceed on putting additional instrument. Prepare the additional instrument. After that is to put the instrument in the open OB pack. Then the nursing diagnosis involved in this procedure is risk for infection due to the improper aseptic technique, and the outcome will be free from any infection. The first step is do surgical hand washing. So I will go to the sink and perform the surgical hand washing. Okay. So now my hands are clean. Then after that is do the gowning and the gloving. rationale behind this reduces the risk of infection between the nurse and the patient.
First, we have to drape the patient accordingly, starting from the legging. Have a blanket with each leg, right and left. Next, we have to drape the abdominal area. Place a blanket on the top of abdomen. Lastly, we have to drape the perineum area, and the rationale behind this is this supports and protect the perineum. The equipment needed here are bandage scissors. Next is the tissue forceps. This is the straight forceps. The Kelly forceps. The needle holder. Then after that, you have the umbilical cord scissor. For aseptic technique, we have the hydrogen peroxide and betadine for cleaning the perineum area. It is also necessary to have cotton balls. Drop the syringe on the sterile area along with the cord clamp. We also need tissue. Arrange the materials starting from the bandage scissors, tissue forceps, straight forceps, surgical scissor, and the Kelly forceps. After that, the umbilical cord scissor, the betadine, the hydrogen peroxide, cotton balls, and the basin. Now, we have to prepare the materials for suture. First, we have to open the needle holder and place the needle on the third tip of the needle. Give allowances to the needle. Inserting the needle depends to the dominant hand of the doctor and lock it properly. If the doctor is right-handed, then the pointed end of the needle will be facing to the left side, and it is vice versa. Place the needle facing downward. Then we have to fold the perineal support like this. Support the perineum properly with non-dominant hand. Will be touching the lower extremities of the patient in order to support yourself when the baby is about to be delivered, and the handling nurse will support the perineum until the baby is fully up. Then drop the support on bed. Then we have to assist the doctor if they needed assistance. So once the head was crowned, check for nose and the mouth. Then after that, we have to check the neck for umbilical cord. Maintain the gentle traction of 45 degrees to deliver the anterior shoulder, followed by the posterior shoulder by lifting upwards. After that, we may proceed on supporting the baby and placing the baby on the mother's abdomen. This involves the unang yakap. Then clamp the cord with 8 to 10 inches away from the umbilicus with Kelly forceps 1 inch apart. Clamp and cut it with scissors in between. We have to proceed with the delivery of the placenta. Hold the forceps connecting to the placenta and wait to 3 to 5 minutes for sign of placenta separation. Then now, we have to slowly pull the cord while the other hand is exerting a pressure above the mons pubis. So once the placenta is delivered, place the placenta on the bowl and inspect for the completeness of its part. And lastly, we have to clean the equipments and instrument to reduce the risk of contamination around the area.
Good morning everyone, my name is Irish D. De Leon from BSN 2, your student nurse for today. And today I will be demonstrating perineal care.
Good morning, Miss Sicat. I'm going to first assess your perineum, just to see if there is any redness or swelling, okay? So I am going to pull down your blanket and assuming that I pull down also the panties. So as per assessment, the patient perineum seems to be a little red. There is a little bit of swelling, but there is no presence of foul smell. So the discharge is a bit pinkish to brownish and the amount is scanty. So by the end of this procedure, we will be able to identify if there are any signs and symptoms of infection. And we will ensure that the patient is comfortable. Good morning, Miss Sicat. So for today, we will do perineal care. This procedure will help us ensure that we clean any vaginal discharge, as this vaginal discharge might cause infection. This procedure will also help prevent any infection. So for this procedure, Miss Sicat, I will be exposing your perineal area. And we will be applying waterproof pads underneath or just above the bed to ensure that you and your bed will not be soaked. So once the perineal area is exposed, we will clean it using an irrigating solution, and then we're just going to clean up everything and then put everything back to normal. So assemble all the equipment. We have here sterile gloves, assuming that these are the forceps, then the cherry balls, and assuming that this is the irrigating solution, the waterproof pad, the bed pad or bedpan, and the sterile perineal pad. Okay, Miss Sicat, I'm just going to expose your area, and then after that, I want you to flex your knee for me. And I'm just going to turn you to the side and I will put on the waterproof pad. So, you can come back now and I want you to turn on your side again. Okay, good. And after that, I will going to put on the bed powder. So, you could turn on your side again and then I will going to put on the bed pad. So I will just be exposing the area that we will assess, which is your period, and I'm going to cover up the rest of your body part. So next, I will going to apply for my clean gloves and make sure that you wash your hands prior doing this on the other side. So my patient is now in a dorsal recumbent position with the knees flexed and separated, and I've exposed the perineal area. And now, I am going first to separate the labia. So now I'm going to pour the irrigating solution, and then after that, with my forceps and cotton balls, we're going to first wipe the labia minora, which is inside. We're going to do the rule of sevens, starting from the clitoris and down, and then after that, we're going to throw away this cotton. And then get a new cotton on the other side now and down, okay? After that, we're now going to wipe the labia majora. So, wipe it again in the same manner, the rule of sevens. And then after that, throw away the cotton and get a new one. And then on the other side. So next is we're also going to clean the middle part. So over here, just downward. And then after that, you can discard the cotton ball. So after cleaning with the irrigating solution, we're now going to dry it. So we got a new cotton balls again, and we're just going to separate the labia. So now we're going to first wipe the inner side. So the labia minora first in one side, and then after that discard and get a new cotton ball and do on the other side in the same way. And then after that, discard the cotton ball. So next is get a new one now for the labia majora. And then after that, discard and then get a new one. And then after that on the other side, and then discard the cotton ball and get a new one for the middle part. So okay, now we're going to apply the sterile pad on the patient. So assuming that I place the client's underwear, so next is we're now going to cover her up with her blanket and make sure that it is not wet. And then after that, make sure that the client is comfortable. So now we're going to remove the pads underneath. So ma'am, I want you to please turn on your side. Next, ma'am, on the other side, please. Thank you so much, Miss Sicat. So next is I will now going to discard all the things that we use in this procedure. So next is I will now going to place them on the yellow bin, including our gloves. So I will going to remove first my gloves, and assuming that this is a yellow bin. So after assessing the patient and doing the procedure, the discharge was pinkish to brownish and the amount was scanty, which is normal for her condition. And so we just document these findings and then put it into the chart, and now we will evaluate the procedure. So as per the patient, she did not feel any pain and she was comfortable while doing the procedure. And there were no signs and symptoms of infections.